Absolutely. Welcome to the closing plenary for the 2020 Water and Health Conference. Before we get started, and while we still have everyone's attention, I wanted to say a few thank yous. It's been a long week, but I did want to thank a number of folks. First, it was an incredibly difficult decision for us to go virtual, and we worried about our ability to produce an event that would deliver the same kind of experience that you would have all had here in Chapel Hill. It was even harder to consider waiving the registration fees, but when we reached out to our partners, they all urged us universally to go forward with the conference, and they said that they would stick with us. And this meeting would not have been possible without the support from our sponsors. And I really mean it. It just wouldn't do it. Virtual doesn't mean free, and it was a hard event to pull off. And we really do thank our sponsors. So I do want to thank our headline sponsor, World Vision. I want to thank our other major sponsors, Osprey, the Latter-day Saints Charities, Watermill Express, Easy Water for Everyone, Chemonics, RTI, the Bill and Melinda Gates Foundation, DevWorks International, DT Global, Simile, Flush, Tetra Tech, and many other individual sponsors. Your support is what allowed this conference to happen and made our being able to offer it free to everyone, anywhere, everywhere possible. And we really appreciate that. Making a virtual conference work is not easy. And in some cases, I think after this week, it's clear it can be even harder than an in-person event. And a lot of people worked very hard to make this conference happen. I want to thank Island Innovations and DP Planning, in particular, James, Sarah, Christian, Mary Margaret, Elizabeth, Tina. They were all the ones working behind the scenes and the voices greeting you in each of the sessions to make sure that everything went smoothly. And thank you as well, of course, to all the session moderators who helped us in each of the events. I also want to thank all of our speakers and panelists, and especially our abstract reviewers. Many of you give a great deal of your time to us free to review the abstracts. And that's not an easy thing to do, and we really do appreciate it. I also want to thank, of course, everyone that submitted abstracts, posters, session themes. We had an incredible number of exceptional submissions, which made the reviewing jobs very, very difficult. But it really is all of you that maintain the quality of this conference, and we continue to need your inputs, and we very much welcome them. That reminds me, do fill out the surveys and do leave us a sentence or two in the chat about the conference. We need to hear from you, and we do need your feedback. I also want to thank the many, many people who spent their time with me discussing systemic inequalities. Wednesday's discussion was a difficult day for me. It was a hard discussion to have, and I couldn't have done it without many, many other folks who worked with me to help think some of those issues through. And so really, thank you very much from me. I also want to thank the team at the Water Institute, Musa, Mike, Elizabeth, Nikki, the team that really made the late early show a success. Neha, who we'll meet in a minute, was critical in making that happen. And I think it's something we want to explore. Can we begin to create events that work 24/7 around the clock to bring some of what we've done here to the rest of the world? And that's something we want to continue to build off of and explore. I especially want to thank Clarissa Brocklehurst, Joe Brown. Clarissa's contributions in particular are too many to name, and we're really grateful for the support she's given us over the past couple of months. I want to thank Catherine Combs and Cody San, both who you probably haven't seen, but have really saved us this year, especially Cody, who despite coming down with COVID last Sunday, has continued to hold us together between naps and ibuprofen. And finally, Kata Liang, who I think you all know. She's the reason why this event is the world's largest annual international conference on water and health. She is single-minded when it comes to her commitment to delivering a product that serves all of you in this sector, wherever you are. And this is really her vision and her effort. And so I can't thank her enough. So as you can tell, it's a team effort. So thank you, everyone, and thank you for your patience as I went through all of that. So now on to our session. As all of you who are familiar with the conference know, we like to use this closing plenary to reflect back on the week, see what the key themes and messages were, and what we can take forward over the coming year to inform our work on water. We are an activist sector, and this is our time to shape that activism and be specific about the actions that we can take to advance the critical themes and ideas that we've developed over the week. So to help us, we've invited a number of folks to join us that we hope can capture the depth and breadth of the conference and help us think about a way forward. So I'd like to invite all the panelists to turn on their cameras. Great, welcome back. Everybody made it perfect. And what I'll do is I'd like you to introduce yourselves, only because that allows people to put your faces with who you are. And I'll go around based how you are on my screen. So we'll start with Jirsan, then it'll be Bruce, Jan Willem, Katarina, Wambui, Canisius, Barbara, and then Sneha. So Jirsan, if we can start with you. Oh, you need to unmute your microphone.
Sorry, this is a common mistake. I'm Gerson Kelman. I've been the Brazilian regulator for water during 4 years, and later during Brazilian regulator for power during another 4 years. At the other side of the counter, I became the CEO of a power company and of a water and sanitation company. The water and sanitation company was Sabesp, serving 28 million people. That's it.
Now I have to unmute. Great, thank you. Bruce.
Well, thanks for having me, Aaron. So my name is Bruce Gordon, and I lead the work of WHO headquarters on water, sanitation, hygiene. I'm going to stress that now in our time and health. Over.
Great. Jan Willem.
Morning and afternoon. My name is Jan Willem Rosenboom, and I am based in Seattle, where I'm a member of the Water, Sanitation and Hygiene team at the Bill and Melinda Gates Foundation.
Great. Katarina.
Hi to everyone. My business card says that I am the CEO of the Sanitation and Water for All Global Partnership. But what I really am is an impatient optimist, a human rights lawyer who believes that everyone has a human right to water, sanitation, including hygiene, and that we need to get our act together to make it come true to everyone. Thank you.
Hi, everyone. Nice to see all of you. My name is Wambui Gishuri. I'm Director for the Water Department at the African Development Bank. I'm also currently the Acting Vice President for Agriculture, Human and Social Development, under which the Water Department falls. I've been in the bank now for 2.5 years, after serving for 20 years in the World Bank, working in multiple regions, and I look forward to this session. Thank you.
Great. Canisius.
Yeah, good morning, good afternoon. I'm Canisius Kanangire. I'm the Executive Secretary of AMCAO. AMCAO is the African Ministers' Council on Water. And yeah, I'm very excited to share with many experts and policy influencers on how we can advance water, sanitation and hygiene in Africa. I thank you very much, and I look forward to share more.
Great, thanks. Barbara.
Thanks very much. So I'm Barbara Evans from the University of Leeds, where I have the great privilege of leading a research group that works on WaSH and health. And I did take a little bit of time before this meeting to talk to my group about their highlights from the conference. So I'm kind of here in their capacity, not really in my own.
Great, thank you for doing that. And last but certainly not least, Sneha, please.
Good morning, everyone. Good afternoon and good evening in this part of the South Asia. It's a pleasure to be here. My name is Dr. Snehalata Mekala, and I work for FANSA. FANSA is Freshwater Action Network South Asia, which is a regional network with 400 plus organizations, and our core thematic areas include lobbying and advocacy, bringing community voices to the international forums, and then evidence-based feedback to the governments and the policymakers and also the practitioners. So we had a lot to learn from this, and I'm very much looking forward to be part of this discussion. Thanks, Aaron.
Great. So sorry, Katarina, you're the what optimist?
Stubborn and impatient.
Stubborn and impatient. Okay. So I'm the cynical nihilist. And so let's see how we reconcile these two different endpoints. And maybe we'll start with Barbara, because you said you canvassed your own group and able to get a sense. So what from this conference are some of the key messages that we need to be thinking about, and what are the things that we want to begin to take forward?
Yeah, great, thanks. So first of all, the feedback was super positive. Just want to share that with everybody. Huge enthusiasm for the breadth of sessions. So one thing that we really heard a lot about, I'm a sanitation person, I work mostly in sanitation, and on the sanitation side, we heard a lot about the urgency of the need and the scale of the need. You know, safely managed sanitation is a whole different ball game to what we've been talking about for many years. And I think that was also, you know, you can see that in the conversations around the relationship between sanitation management and COVID, for example. And so one of the themes that I heard a lot was, I would sum it up as professionalization. You know, there are so many strands of knowledge and information that need to be pulled together across many disciplines if we're actually going to deliver effective, safely managed sanitation across the board. And I just wanted to sort of say that I think one of the things we need to do is take these strands, you know, understanding the health impacts, understanding how consumers respond to what's on offer, understanding how we can manage wastewater treatment better. On my side, you know, we've done lots of work on costing and the economics. So we really need to have a vision that I think within 10 years, we need a whole new community of professionalized sanitation expertise out in the field if we're going to achieve this challenge. You know, we can't do it as a sort of side byproduct of other sectors, and we can't do it as a kind of charitable voluntary piece of the puzzle. It's really, you know, I heard lots of people bringing really rich, complex ideas to the table. And I think one of my sort of big questions or challenges coming from it is, how do we synthesize and get that knowledge and experience out there on the ground? And I wanted to just make one final point about that, that we started the week talking about COVID, but also equity. And as you know, Erin, you've been a real sort of champion of pushing that discussion around equity. And even that, I think it's really important that we see the need for really high quality professionalism when we engage with that issue. It's not something we can all do as a hobby on the side. We need people who really thoroughly understand the issues inside the house, helping us to deliver equitable, you know, safely managed sanitation. So if I had one theme, it would maybe be professionalization in sanitation.
Yeah, I think this is something that, of course, we have to think really seriously about in the sector. One is, how do we bring the right skill sets together to solve what are very complicated problems and develop the integrated research teams that we need to be able to do, because we all try to be very stovepiped. But the other, and I know this is important to Katarina, how do we build the right research and learning institutions that will allow us to build the professionals that can allow us to do this work? So that's critically important. And I'll come back to Katarina and Jerson Wambui to comment on some of these things, but maybe a couple of quick reflections as well from Bruce, Jan Willem, and Sneha as well about key takeaways, and then we'll go around again. Bruce? Yeah,
thanks, Erin. And I was going to say, I wish I had Barbara's spy network, but we did actually have quite a WHO team, and to pick any event is always going to probably upset someone on the team because there was just so much going on. But one thing that really struck me about what Barbara just said about professionalization is it really links to this inequality story. And what I mean by that is, I thought, like, honestly, and we were talking about this earlier, Erin, that the inequality discussion was a really brave discussion. But what was interesting to me was, you know, it hit so many strands on a personal level, but then when it comes to actually doing something about it, and I was just on a big WHO call with all the senior management, we were talking about how to actually use data and information to target, you know, those without access and the most vulnerable. So there's a very, how do I say this, a professional and very, you know, kind of evidence oriented piece here that needs to inform this very passionate topic. So we got to get serious. We got to roll our sleeves up and say, we got to get this, you know, more embedded into planning with really good data and information, and actually tracking the funding that goes into those areas and seeing how much impact we have. So I think we're doing the right things. We're having the right discussions. We just got to go sort of further and faster on that inequality side of things. Over.
Well, one of the things I know that came up in my conversations as I prepared for this was that a lot of our data is wrong, and that the way we've collected data has unfortunately been biased by our own unconscious prejudices as we've worked through this, and we may not have been collecting the right kinds of data that we need to get a full understanding of some of the challenges that we're facing. But I'd love to hear reactions to whether or not that's true or not as we go along, and other things that we need to do to build some of that out. Jan Willem, did you want to reflect on some of the key takeaways?
Sure, thanks. I'll try anyway. There's already some nice threads coming along. I think before talking about that, I wanted to. You started out saying, you know, it wasn't an easy decision to go online, and I want to say thank you for actually deciding to do this. I know it was a difficult decision, but I think it was great. And one of the things that going virtual has allowed us to do is you know, there's 3,000 people registered. This is easily the most inclusive conference in the history of the UNC conference. 120 people, 120 countries represented. No issues with travel, visa, stuff like that. And so, great. And my question for next year to you and to all of us is that how can we keep some of that, right? If we all hope we'll go back in person, is there a way to have a mixed virtual in-person conference that keeps that inclusiveness and openness going? And so to stay with that theme of inequality in the session on Wednesday morning, I'm like Bruce. There were so many points of personal recognition for me, right? I'm a sanitation engineer like Barbara, but I'm also part of the white patriarchy that has been running this development sector for much too long. And it is so easy for us not to deeply interrogate our own assumptions, the way we work, the way we make decisions, and to have that called out was really great. And it kind of leaves me at this point where I'm like, well, where do we go from here? It is so easy to underestimate what is required to make progress. If you think that poverty is rooted in systems and structures and the way, you know, the world is organized, how do we make meaningful change? How do we make change that doesn't make things worse or doesn't look like an improvement without actually being one? And one of the things that struck me that is a starting point is how do we listen better to each other, better to our partners, and use that to understand what is needed, which I know for me as a donor is hard, right? Like as the Gates Foundation, we are so vocal about our own strategy and about what we see as priorities that to make space in that to say, hey, I have 2 ears, 1 mouth, right? Like I need to use my ears more. So the question to the panel and the question to you is like, when we come back next year in October, what are we going to do differently? What will be different? And how do we collectively agree to make changes, even if they start with small steps? Thanks.
Yeah, it's a really fair point. And Kata and I were discussing this last night. We're not sure if we can go back. And so I think we've opened up Pandora's box, and I think that, you know, we're determined to try to do what we can to keep this open to as many people as possible and to create knowledge exchange and get it out to people who need to hear it. And I'm anxious to hear Sneha's views on this and how the Asia part of this worked. But we're committed to trying to do that. But how do you do it and make it financially sustainable? You know, because we do have costs we have to cover. And this is a real conundrum. But I think, I don't know, it's a conversation that's going to go on over the next couple of months as we think this through. But Sneha, you did an incredible job, because part of this outreach was that we and not everybody knows this. So we tried to set up a late early show where it was started at 11 o'clock to midnight our time, so that we could create a live element for our folks out in South Asia and the Pacific, and we could engage them directly as they then began their day and access some of the recorded content. And so while the content was there, we wanted to create a live element. And Sneha, maybe you could comment on, what you took away from the conference, what key messages came out in those conversations. What did they want that was different than what we might have seen from the conference discussions that we had, here during the day?
Thanks, Aaron. I think by physically present in the conference, perhaps we would have heard about 1 or 2 sessions, but being in the late early show, we had a gist of the entire day's proceedings. I think that was much more enriching and experience that we learned in this part of the world at early hour 8:30 having a breakfast. I think that was wonderful. And the interpretation of the experts from South Asia side on the deliberations were very informative and very, very knowledgeable. I think I think there are so many takeaways from this conference. I think let me just start with the amazing technology that has brought together all of us into this conference. I think as Young William was mentioning, that 3,000 people in a conference virtually attending the shows were, I think it's fantastic. And the kind of virtual tour that we can take in this website, I think it's very, very informative. And then we have got a lot of insights through this, and a lot of colleagues also shared that anyway would have not got an opportunity to go to the conference by paying so much fee or by physically traveling, but this has really helped is what they have shared. And some of the main takeaways are like, the leadership is very important when you really want to do work. As WaSH is an agenda that we all have been pursuing, and the governments were also allocating certain budgets. But even some of the African countries who did not have much resources for allocating to the WaSH, some of them have said that this has really emphasized the need for inclusion of budgets into their regular programs for WaSH, which was very, very good. And then how important financing, especially for reaching to the LNOB. I think the whole session on day 2, which was presented by Young William, was so informative. And then I think the most important thing, again, we were talking about inequities and the systemic inequities. In that session, some of the colleagues that were talking about how important it is to look at the priorities of those communities which are left behind, rather than going with the top-down approaches or designing a program or project from our end, asking some surveys, what do you need or what do you want, or this is what you need to do. Instead, I think there are solutions to be offered by the people within their resources in the communities, which was emphasized in the session on systemic inequalities, was very, very informative. Last not least is the kind of outreach that it has among the South Asia participants. I think, again, kudos to your idea, Aaron. It was really, really enriching for all of us. Thank you. Over to you, Aaron.
Yeah, again, don't give me credit. The entire team gets all the credit for this kind of stuff. They just did a great job. No, but that's, reinforces, of course, Jan Willem's point about listening and how do we engage the communities that we want to work with and how do we support them. None of you talked much about COVID, which I found interesting. I appreciate the focus on sanitation. That was a key theme, and equality is a key theme. So it sounds like that in terms of key messages around COVID, was there anything there that we should also be highlighting? I'm just looking to see if there's a hand wave from Bruce.
Well, that was second on my list.
Okay.
And I think it was, just to say, everyone's fascinated by the science, I think, of COVID, the enveloped, the structure of the virus, whether it's resistant to disinfectant, so on. But I guess I think the impact, the bigger question is the impact on the WaSH sector, and one of those, as we know, is the hand hygiene business. But I think the stuff that we don't know is just how it's affecting service delivery, how it's affecting resource allocation to WaSH, how it's impacting perception of WaSH in wider kind of sectoral discussions. I mean, you know, and by no means, I think this is reflective of other institutions. Within WHO, WaSH is suddenly shot up in prominence. And I'm not sure if it's because of COVID or not, but anyway, so I think all these discussions about what is the impact of COVID, how do we kind of harness that, are things that we need to continue. And we began with the technical discussion. Over.
You and I have talked about this, and I don't want to, well, no, I am going to maybe speak for you for a second in that, you know, when we've talked about it, we've stressed obviously the importance of PPE and making sure that our frontline workers have access to the protective equipment that they need. And that's certainly an immediate urgent need that we've got to meet. And then as a long term, you know, we start thinking about service provision and how we make service provision part of our preventative process for the spread of infectious diseases and how we bring that in. And certainly, I think the other area that didn't come up much in the conference, but it gets a lot of attention, is how do we support our utilities who are providing these services, who right now might not be able to recover costs, and how do we make sure that they can continue to go on? Barbara, I thought you had a point you wanted to add to that.
Yeah, I just wanted to say that we have a long history also to build on it. I mean, you've just touched on the point at the end there that I think, you know, most of us are in this business because we believe that WaSH is a fundamental tool for supporting resilient, equitable growth. And I think COVID just shines a more shocking light on that than ever before. So not to say we can exploit the situation, but we shouldn't forget, you know, this sort of the fundamental public health argument is something we have to keep making. You cannot address a big global pandemic if you have health centers which don't have adequate WaSH services, you know, and if people have to go out of the home to collect water, how are we going to tell people to stay at home? So I think that's sort of, that it really reinforces for me that the idea that in 2020 we still have such huge numbers of people without adequate, reasonable WaSH facilities at home, it should be, you know, one of the biggest scandals that COVID reveals, really. And I do think we need to be making that argument collectively.
Jan Willem.
Yes, I wanted I agree with Barbara, and I think in terms of the sessions, you know, yes, the science was great, but I was also so glad with the session that immediately followed the science one, where we heard from different countries and how that affected them. But I want to take it back again to the inequality question too, because if I just look at my own journey for a while, and you say, well, you want to change the world, right? Like the structures are unfair, people are poor because the systems don't work right. And so then working in WaSH, I can feel pretty good about what I do, right? I believe in what I'm doing. WaSH is fundamental to people's health and well-being. If I look at what's been going on over the last 30 years in terms of trends in poverty, trends in access, again, you know, lots of stuff to feel good about, right? Like we're working on the right things. And then COVID hits, and in a space of 9 months, we lose 10 years of progress that we have made. And I have to go like, wait a minute. So all that change we've been seeing maybe wasn't quite as structural and fundamental as we wanted it to be. And I agree with Barbara, that's a huge shame. And we should use this point as this tremendous, expensive wake-up call to say, well, what do we really need to do to make the world a better place and to make change stick?
Yeah, Bill, I think that's exactly right. And for me, I think even my own views have been changing quite a bit around, have we just been putting Band-Aids on these problems, and have we not really been going to the source to create real systemic change that's going to be critical here? And Katerina, maybe I'll go with you first. And you know, you obviously bring a lot of different perspectives from this, both from your past career about looking at inequalities, but also currently now, especially with SWA and how do we mobilize expertise. some of the key things around professionalization, around research and learning, around addressing inequalities, around systemic reform, which of these resonate for you, are messages we need to be taking forward, and are there opportunities to do that over the coming year?
So I wanted to say, I will answer your question, but first I want to react to Barbara and Jan Willem. And one of the things that I learned during this period of COVID was that my expectation was that people, the world, everyone would finally realize how important WaSH is for sustainable development in general and poverty, and to avoid pandemics, the vaccine before the vaccine, etc. And then I started talking with our ministers, with the SWA sector ministers, and I had this shock because I thought we will have our 15 minutes or 15 months of fame. And actually not. I think that we got from the sector more convinced of the importance. I'm not sure that beyond our sector, maybe I'm being very too negative. And why I'm telling you this? Because I talked with several sector ministers who complained to me that when WaSH committees are being, COVID national committees are being created at country level, they are not invited. When there is more money being put into the country for COVID response, they don't get a slice of the pie. Slice of the pie is their expression. So there is something profoundly wrong in stuff that we are doing. And this makes me think more and more about, on the one hand, so the learnings. Of course, we have more opportunities and there is more visibility put on the sector to a certain extent, and to hygiene, etc. I think we are not connecting all the dots, or the public in general, and the prime ministers and the finance ministers are not connecting all the dots, maybe. But then the other thing is the realization that we need to leave our comfort zones. We need to talk with others. We need to knock on others' doors. The others must become our sector's champions. People working in education, on health, on employment, prime ministers, heads of state, heads of government, etc. So they need to become our champions. They need to understand that what we do is basic, and that for the world to work, we need our sector. This is one thing. Then two more things. Then I think that we need to take 2 steps backwards, and I'm thinking of the issue of inequalities. We need to take 2 steps backwards and ask ourselves, okay, what do we need to change to make the world a better place? And yes, it is much more challenging than just, and I'm not saying that this is not good enough, than just bringing some latrines and some water pipes to some places in the world. I think that we need to look at, and now my undiplomatic statement, I think we need to look at the global financial architecture. You might have read a statement by the Ghanaian Minister of Finance in the Financial Times at the beginning of the month, where he said we need a tectonic shift in the global financial architecture. And he said, even if the group of 20 nations, the G20, representing the world's biggest economies, have agreed to extend the suspension of their payments by an additional 6 months, this is not enough. And it's not enough in particular, and if countries were already having difficulties in paying debt before COVID, what is the situation right now? The UN Secretary General has also made statements on that regard, saying that we need greater liquidity, that debt relief must be extended to more countries, and that we need to align incentives in global financing with the SDGs. So I think that we need to think about the big picture, number one. And also we need to talk about something that we were talking about in another panel here at the conference, which is the legal and political framework also inside the countries. And you were talking, Aaron, about land tenure. And land tenure, you can find great solutions to close an eye to informal settlements, but that's not the way to address it. And of course, addressing informal settlements and land tenure and all these issues will shake up financial interests, political interests, etc. But this is what we need to change. We cannot go on with business as usual. And I think we need to start pushing the political boundaries, and we need to bring these topics to the forefront. Otherwise, we won't solve anything. Or we have a little step forward and 2 steps backwards. Over.
Wambui and Gerson, I'm going to ask you about that land tenure question and the kinds of systemic reforms we need to drive in a second. But Canisius, maybe to you first about, I mean, you've got a process with all these different ministers that we can reach out to and we can try to push their thinking on. How is it that and you've been working, of course, over the past year and a half, 2 years on the sanitation policy. What messages out of this conference, what are the things that are resonating here that we might be able to use AMCAO as a platform to change how some of this is happening within Africa?
Thank you very much, Aaron. Allow me, before I go to that question, to complement what Katarina has just said. I think one thing we learned from COVID-19 is also that it, in a way, ignited the eagerness of ministers for coordination. Because we organized one meeting to coordinate the action of WaSH ministers, their response to COVID. And 2 months after, they requested for another meeting to update themselves and exchange the solutions so that they can learn from one another. I think that is a very positive thing. If it remains the peer-to-peer learning mechanism and continue to build on the experiences instead of repeating everything, will be a very good thing. And it will probably continue and result into a sound plan for the building of a more resilience to pandemics in the years to come. Now, on what this conference has brought and what we can continue to work on with the Council of Ministers. First of all, this conference provides a lot of scientific updates on sanitation and creates that linkage that we need between science and policy. And that is something we have been, in a way, struggling for on the African continent, to bring science in the decision-making, in the policy-making. And that is what we are also trying to have as we develop the African sanitation policy guidelines, so that policies in Africa can be aligned to the core element of the SDGs and the needs of the African countries, because they are diverse in the levels where they are. So bringing in scientific evidences which are generated by all the contributors to this type of conference and continuing to work together, science and policymakers, I think it will make a huge advantage to what we are trying to have on the African continent. And I think that it will also contribute to addressing inequalities, because building again on COVID, I think we saw now very vividly that as long as we will keep the inequalities, we will not be able to address issues in a sustainable way. And science and data from different monitoring systems and different studies will certainly contribute to alerting decision makers of where we need to put our investment more, so that we can get a real transformation in the sanitation services, and also get a more resounding impact in the changes that we want to bring to our people. And I think if we do that, then leaving no one behind will be a real thing, not a slogan that sometimes we just say to please our listeners. Back to you.
No, you've raised a number of important points, and Wambui, I don't want to put all this in your lap, but you know, you represent an institution that can play a really important role, I think, in addressing some of these things. And some of the issues that Canisius raised, but also Katarina raised, and there's a question, of course, that we've got that's saying, well, but food security, health, they get all the money. The WaSH sector doesn't get any money. And that's whereas, Barbara's point about it's really important. I mean, the WaSH investments are critical in healthcare facilities, in homes, in other things, but we have to contextualize that within environmental health. And if we're not dealing with and ensuring that these healthcare facilities have power to disinfect equipment, that they've got healthcare workers that are trained, that if other sources of healthcare acquired infections are not being addressed, we're not really addressing the system in a holistic manner. It's the same thing that Katarina raised around land tenure, which I think is obviously critically important to enhancing access to safe drinking water and sanitation. Yet when we check the box as to whether or not that money counts when we're counting for investments in WaSH, we often don't count those kinds of investments as a WaSH investment. I mean, are we missing are there other investments we need to be thinking more seriously about if we're going to address some of the core challenges around water and sanitation, around the types of diseases that it causes, that you now are in a better role to see and operationalize?
You're asking
Thank
to
you.
me?
Is it me?
Yes, please.
Okay. Okay. So thank you very much. And again, I'll start by sharing what we have learned, and because it also links with the previous speakers. As I said yesterday during the practice session, I think we have seen a lot of heightened awareness on the importance of WaSH, but also consequences of lack of it. I think that we have seen, people who normally don't talk about water, really talking about water. Before the lockdown, we had hygiene messages in the corridors of the bank, in the bathrooms, in elevators. So it's a good moment. And everybody's talking about washing hands. Did you wash your hands? But the question we have is that how that will translate into prioritization and increased investments, as Katarina has alluded to. I think that the other lesson that we've learned is the bank provided a lot of funding. We actually redirected much of the 2020 lending towards supporting COVID. But it's clear to us, even though we cannot measure how much went to WaSH, is that there was a lot of galvanization at the local level. NGOs, local private sector got involved in many places. But now that it's a priority, despite the increased and heightened understanding, is not clear to us. So what we need to do going forward is something we need to think about very carefully. One thing we've learned also as an institution is the importance of thinking the link between water, health, and economic development. That the idea of thinking very sectorally, whether you're thinking about it from water or WaSH or health, or the economics vice presidency that does budget support, etc. That in Africa, this is what started as a health crisis, is for the next couple of decades going to be about economic and social impacts, and that we cannot delink health and WaSH from broader economic and social impact. So in fact, one thing the bank is doing, the African Development Bank didn't have a lot of engagement in health. And in August, the Board of Governors has asked management to try and articulate how the bank will increase its engagement in the health sector in Africa. The vulnerability, and also we didn't learn enough from Ebola. The world thinks that feels, and rightly so, that this pandemic, Africa has learned some lessons from Ebola, but there's some important lessons we miss, that our health systems are vulnerable and they cannot manage these types of crises. Ebola was much more localized. Of course, it was only in a number of countries. But those same countries that had Ebola aren't better equipped today to deal with COVID-19. So I think what we did was not think about the resilience of health systems, not think about water systems in a systemic way, the reform of institutions. We have, I think Africa has mostly thought about an emergency has occurred, deal with the emergency. We've missed the opportunity to deal with the emergency, but use that opportunity for long-term sector development to make sure we have institutions that can tide us through the next pandemic. So not a new lesson, but it's a gap that we need to think about. And now we even need to think more about resilience in multiple ways. It's not just about pandemics, it's about climate, it's about droughts, floods, etc. So I think that for us, the awareness by other sectors, we've also seen, for example, that we all plan short term, governments, external partners, and no wonder then that the long-term thinking, the long-term opportunities that an emergency presents is never taken into account about how do you not struggle at the next pandemic. Now, for Africa, we feel that we need to invest, given the vulnerabilities of the population, we need to invest a lot on the preventive side, and that in many ways will mean water supply, sanitation, and nutrition. So agriculture has taken a big part. It's a big sector in the bank, and issues of land tenure are discussed more frequently within the agriculture sector. But to the extent that this jointedness that COVID has forced us to work in, we have really, as an institution, over the last, since March, we've really worked together in ways that we haven't done before. People in social protection, in health, in WaSH, in agriculture, the economics vice presidency, including energy, because if you have health centers that don't have electricity, they are not helpful. If you have, you may have money to drill boreholes, but if there is no electricity, and even within our own institution, the countries, fragile states, our staff in fragile states have difficulties even participating in bank meetings. Think about their clients, in those poor countries. So I think the extent to which we must work together, and that's going to take a long time. And therefore, we need to think about how we plan together. And we start by thinking about the results away from the inputs, because we're very tempted, I think, as a development community, to focus on what we can count. And what we can't count quickly, which is what is more important, we're not counting. We need to really think about what we measure and how we measure, and take a long-term view. Otherwise, we have no chance at all for having a systemic, not just systemic development, not just within the sector, but now we know it has to be done together with other sectors.
No, that's wonderful to hear, in particular, because I think it's really easy for us to run away from some of those challenges. These really hard things to do, and especially taking on issues like land tenure, as Katerina mentioned, really politically very difficult to do. And we'll come back to that discussion. I'll come back to Katerina in a second, but I do want to hear from Jerson real quickly about the private sector and the private sector's role in trying to address some of these challenges, and whether or not these ideas, and I know a lot's been happening in Brazil actually very recently, to try to get the private sector more engaged in addressing some of these more systemic types of inequalities and expand service provision. And in COVID, I don't know if that's made things harder or easier, but I'd love to get your reflections on that. And then we'll open it up to a conversation from the group about how do we take some of these things forward over the next year.
Thank you, Aaron, for this very interesting question. Brazil just approved 2 months ago a new law for the water and sanitation sector. And this came as a result of COVID. COVID came to the headlines of the newspapers. Everybody was talking about this, as many people mentioned this. And so Brazilian Congress put this discussion ahead of other issues that were also very important. And the new law compares the services of water and sanitation that Brazilians have with, say, electricity. And in electricity, 100% of Brazilians have access. All Brazilians have access to electricity, but when it comes to sanitation, roughly half of the population, 100 million people, don't have access. So what's wrong? How do you compare the two sectors? If you look to the electricity sector, in Brazilian, of course, and we have a place where two very important words. The productivity of the utilities and the governance of the utilities is very good. It's very good. You have very good regulatory environment, and private investors can invest because they know that their money will be respected. There is a friendly environment for private investments. This was not the case in the water and sanitation sector. And if you look at the Brazilian sector, there are 5,000 municipalities. There are some very good water and sanitation companies. I was the CEO of Sabesp, serving 28 million people. They have stock in the New York Stock Exchange, in São Paulo Stock Exchange. It's a profitable organization. It's very good, provides, it doesn't depend on the government to give any taxpayer money. Everything comes from the tariffs. So it's very sustainable, but this is an exception. Most of the utilities are lousily run. They don't serve the population. They serve the interests of their own corporation, and they serve the interests of the rich part of the population rather than the overall population, something related to inequalities that you refer around. So the scope of the reform is to emphasize the need to governance and productivity, creating an environment for the private companies to invest here. And this means good regulation, and this means security on their investments. It's very soon to tell anything if this will be successful or not, 3 months only. But in these 3 months, there were already 3 auctions, and I would like to just briefly, Aaron, to say, to try to prove the concept that productivity makes a difference. One of the auctions was to choose the utility that will serve a metropolitan area in the Brazilian Northeast, very poor area, 1.4 million inhabitants. 2/3 of these people don't have access to sewage collection. Well, there was a very strong competition among 7 Brazilian companies. There are no foreign companies here. 7 Brazilian companies disputing the right to 35 years contract, and the winner paid $360 million to get this contract. What I'm trying to prove? I'm trying to prove that the previous company, with government-run company, lousily run, due to very low productivity, could not deliver what people needed, and this is feasible with a private company with higher productivity, and people would pay for the service that they are paying anyway, because they pay for water, so it's sustainable. This is what I'm trying to say. Well, we have to see the years to come if these good initial results will sustain, of course. But at the moment, I'm very optimistic.
No, it's an incredibly important message that private companies think they can actually make a profit by extending services to marginalized and poor communities. Yes. That's an incredibly powerful message. Katarina, I know you wanted to add to this.
I wanted to add something to the research and learning institutions, because you were all talking about it before, and I do think that you have a crucial role to play in all of this. And connecting research and learning and inequalities, I think more research on the inequalities, which inequalities are there, what are the sources, what are the reasons, etc. and then research on, okay, what is the impact of these overall inequalities on access to water, sanitation, and hygiene. And I then think that it would be important, as Wambu was saying, to have this interdisciplinary work with other areas, with economists, with lawyers, with people working on health, etc., and work together in enabling and influencing decision making, but also in paving the way for better laws, for better policies, for better budgets. And I think that the research and learning community can play a huge, important role in making sure that things change for the better, and in making sure, in collecting good practices, in showing this has been done. Why don't you look at the budget with a gender equality lens, with an equality lens or generic equality lens? How can we infiltrate equality in the way a budget is put together, in the way a law is being put together, a policy, etc.? So I think you can have a huge, massive contribution in pushing the boundaries and make things better and address the systemic underlying inequalities that we are talking about, because you give credibility to slogans. What I'm doing here is talking a bit about slogans. Okay, I know that I have science behind me, but you can do a lot with studies, with science, with facts, etc., and research to make sure that we change these things that seem immutable but are not. Thank you.
No, I think you do know. And I think this idea of, you've given us a charge as a community. We need to expand our research into some of these inequalities. We need to bring in some of the social scientists into our discussions here. This is part of, I think, what Barbara was getting at in terms of how we move forward in the need for interdisciplinary research. I'll go to Barbara, Jan Willem, and then Sneha, and then Wambui.
Yeah, so maybe just a linked thought there. I mean, obviously, I work in a research organization, but I also work in a training organization. And, you know, we train a lot of people in the WaSH space. And I think the other thing, and just listen to Jerson and Canisius, I mean, listening to all of this, I think the other thing that we've really got to start thinking about is when we need to find ways to incentivize the training structures to train people to be problem solvers and not to just have knowledge. I think one of the biggest sort of barriers that everybody has in these kind of professional spaces is, here's what I know and this is what I'm going to deliver. Now tell me what the problem is. And, you know, we've really got to get more to that. Right, I'm trying to get those services into that. So Jerson was talking about that low income community. And I'm presuming that one of the reasons why the utilities he's talking about are productive is because they have some bright, you know, really highly qualified engineers and technicians and finance people and social scientists who have ideas about how to go and do the formative research, find out what services people want, work out how to structure a tariff so people want to pay it and are willing to, all of those sort of things. And the reason why they're successful, I would be fairly sure, is because they didn't say, we have to deliver this type of service using this type of tariff with this kind of collection regime, blah, blah, blah. They said, how can we make sure that at the end of the month we're collecting the tariff, and that means we have to deliver a working service? Now, how should we do that? And they, I'm sure, went to that with an open mind. So one of the things for me as a teacher, and as a hopefully occasionally a teacher of people who will go on to be teachers, is that I think we have to get smarter at training people to, not just people that are going into academia, but people who are consultants and people who go into the development agencies, to be really looking at every problem as, right, what actually is the problem here that I'm trying to solve? Now let me deploy the tools or bring the specialist or whatever it is that will help me to solve that problem. I feel like we have far too many people with solutions in search of problems rather than looking to solve the actual problems on the ground. So for me, that's a real wake-up call. It's the thing that keeps me awake at night as an educator. You know, and it's not an easy thing to teach people, but it's absolutely the charge, I think, for those of us who are in the education space, because, you know, problems are going to be massively complex and they're going to change hugely even in the next 10 years.
No, I 100%, and I'll even go beyond that because I know you believe this as well too, which is when we do, nothing we do that is going to work the first time. And so collecting the right data, analyzing that data, going back and iterating on those processes, this idea of continuous quality improvement, how do we do a better job and continue to adapt to changing conditions? And that's a skill. Being able to do that process in and of itself is a skill, and it's not knowledge-based per se. It's about knowing how to manage a process of collecting and collecting. Really important point. Jan Willem, please. And then back to, I think it was Sneha and then Canisius.
Unmute here for a moment. Thanks, Aaron, and thanks, Barbara. So I have a question for Barbara linked to what you just said, and then a question for Wambui and Canisius, also related. And the question to Barbara is as a teacher and a researcher, how do you then teach your students to go beyond their research findings and ask the question, how is what I am researching relevant to policy? How do I translate that? And even more importantly, maybe, is this worth translating into policy? How do we answer the questions like, okay, I have my little research findings and it's new and it's exciting. And we've seen a lot of that this week, and it truly is new, it truly is exciting. But are we always good enough about asking the questions when we deal with policymakers, local government, national government, and we tell them they need to scale this up? Are we aware enough of what that means in terms of budget resources, capacity that's needed? Is it actually the right thing to scale this up? I know it can be done. I know the research findings are exciting. Is this the right thing to do? How do you have that dialogue and make decisions about that? And that then brings me to the point that Bruce raised all the way in the beginning, and that kept coming up in the conference as well, which is the question of data. Barbara, in one of your sessions about Cactus, you said, it was actually really difficult to find data, and you sent out a call for collaborators and others who could contribute. And we hear time and time again that countries don't have the data they need, utilities don't have the data they need, yet we all agree that data is fundamental to planning and decision making. And my question to Wambui and Canisius is, when we make investments and when the AFDB makes investments in service delivery, how do we get to the point where we discuss with countries how we invest in systems for collecting and management of data at national level, rather than these bespoke data collection efforts that allow a development bank to design a project. The data isn't there, so we'll invest in a bunch of consultants to get what we need, design a project, and go forward. How do we change that dynamic and say, as part of this investment, we start investing in systems at country level so we don't have that recurring problem? Over to you.
He just defined a new theme for next year.
Can I step in, Aaron? I will be
very short, very quick, please.
So you're quite right, Jan Willem. So two quick things. How do we teach this? One is that we find groups of people who can learn together, who come from the different perspectives. So we very rarely have a room with just academic theoreticians in it. We're very lucky on our program that we have people coming with experience from government, technical people. I would make a small plea to the sector as a whole. Jan Willem is a perfect example of this, and I was very lucky, but completely by accident, to have had the experience of having worked as an engineering consultant and as a program officer at the World Bank, and now I've spent 10 years in a university. I really wish more people in the sector would do this. I think Gerson should now be a university professor. I think, Wambui brings that practical experience. More people need to move around. If you want your universities to get it, then go muscle in there, guys, from the policy space and, challenge the academics. There's nothing mystical about universities. Most of the people in universities turn out to be really, really dumb. So don't be scared. Just go in there with your knowledge and experience. I can speak from true, honest experience there. And
thank God you said that.
It's important.
This is all reflection of my own personal struggles now stepping into academia from a policy related career, but I couldn't agree more that how we shape research to really influence policy is an art form. And it does involve economics, and it does involve addressing the core issues that ministers and politicians care about. And we need to find ways of educating our scientific community to reflect what they do in those ways, or else they're not going to need us anymore. And that's a real problem. Sneha?
Hey, thanks,
Can
Aaron.
we respond?
And now I'll come to you, Wambui. Sorry, right after.
Oh, okay.
I an issue that when Katharina said that R&L community has to, break the boundaries and then have to go forward and then think about this. I would like to raise a question. How far is there a space at the country level for the CSOs who bring the success stories of doing the things right on the ground? And as young William put it, they have an evidence of how much needs to be resourced in, what human resources are required, what kind of budgeted, what implementation process, everything is there with them. But when we go and then present at these platforms, it just gets dismissed by the policymakers, or even at a highest level, sometimes even the donors, saying that this requires too much of funds, or that you have done such a tiny success story, whether we can really replicate it. We don't really see that kind of an encouragement within the sector from the governments and donors that yes, you have done a good job, there is a scope and you can do this, and then there are lessons to learn. Do we have these kind of collaborative platforms to learn? Do we have enough evidence to take whatever the CSOs have brought in with the evidence? Are we taking this? What kind of space are we giving for the CSOs to bring all these kind of issues? And are we really connecting the bridge between the communities who are at the lowest level to the policymakers to give that kind of a feedback? I think these are also some of the important questions that we need to really reflect upon. Over to you, Aaron.
No, now you know why she's here, right? It's exactly right. And how we build the institutional mechanisms at a country level to support research and learning, and to ensure we can bring those CSOs and those local actors into the policy discourse. Incredibly important, and something that needs to happen. Wambui, please. And then I know Canisius and Katarina have things they want to add, and Jerson as well.
Thank you. There are many points to make. I just starting with Jason's. Congratulations for the approval of. I know about it from years back, but I think that Latin America is a region in general that likes homegrown things. And my experience also is that even in poor communities in Africa, if something is homegrown, the questions you're asking, the questions we ask and research about, if they come from within, even from very poor communities, it's amazing how much traction you get, because what's happening now is that the research questions are coming from elsewhere, and then you have to sell them to those with funding, the communities that need services, etc. So I think what I'm learning is that thinking together upstream with the different stakeholders so that you can agree on the research questions, because you need those findings to Jan Williams' point, you need those findings to improve the way we work on the ground. So, and even within the bank, if we don't get together with departments and define a topic, a question jointly, to be honest, it doesn't go far, even within an institution. So that's one upstream. The other thing I wanted to ask is that I just wonder whether systemic thinking, long-term planning, what we count, counting what really matters, whether it can be done with the kind of leadership we have in the sector today, or do we not need to think about what there is today, but adding, much more adaptive kind of leadership, because these sectors are not as easy as we think. I think that where you have, and we've seen this, we've seen that when we get people from outside the sector taking leadership, they do really well. They go through moments of, they're sidelined by the staff they're leading, but in the end, William Muhairo is not from the sector. Some of the utilities, when they implement reforms, they are rarely getting the same managers that have been in the sector with the same kind of thinking. So I really feel that we need to rethink the leadership aspects in the sector and make sure that whoever people of the future, and this also speaks to Barbara's point about training, who you train, how you train, how do you determine the training, how do you measure the training? Because training can also be, it's also very driven by short-term goals, what we can count, how many people we have trained. So the adaptive nature of future leadership is what I pick up everywhere I go, because our sectors have really to take account, to take cognizance of the socio and political context. And if we have sectoral people in the old way, we don't do well. In terms of utilities, for example, where people have had the flexibility, for example, to recognize that it takes a different skill set to understand the socio-political and economic context, say, of low-income areas, rather than just, they're on illegal lands or, leave them. There has been success where you open a unit, you set up a department, and that's leadership that recognizes that the skills we have are not sufficient to serve everybody. So for me, future leadership in the sector is something we need to think about to be able to move.
And how we get some of the very individuals that Sneha is talking about at the CSO and community level into leadership positions. That's something that there's real barriers to having happen. And that's something that we need to take on institutionally. And I think that needs to happen. Bruce, did you have a quick comment before I go to Canisius?
Well, it was just on that just getting people involved at this from the local level and the CSOs. And maybe I'll just say this, because I think we have this issue where people are trying to say, fit into my box and use my language. And, whether it's, whether it's our health sector colleagues, whether they're working in NTDs or even AMR and other things like that, they want all these things. We just had a discussion for the cholera group. They want to integrate into the WaSH community, but we're not using the same language. Just like maybe the CSOs don't know, or the local government doesn't know the language of the international community. So what I think is, if we return to Jan Willem's point about challenging ourselves in terms of how we do this conference, that language and that fit into my box thing, we deal with that in a preparatory discussion. So no one's intimidated. So Barbara, you said, sorry, but you said that don't be afraid of universities. But I've seen policymakers with the academics, and all the policymakers and the government officials are dead quiet because they're scared to debate the academics. And so we have to break that down. And I think we do that ahead of the conference. And I think if we have a virtual kind of preparatory process, we learn from this, we can actually have a dialogue where those barriers are broken down and we can get some of these people a little bit more in leadership positions, I think, anyway.
Well, but Bruce, again, it gets back to the inequalities discussion. Those of us in academia, those people who are lawyers, those people who are credentialed in any way, want to protect those credentials. They want to maintain, their role and their legitimacy in the sector. And I think we all fear about simplifying the language to the point where everybody can talk about our issues and everybody can be engaged, because who would hire us anymore? But it's a really important point, and one that I think we have to make a big effort to try to address. Canisius, so many things have been raised, and Wambui's point about we need to hear from leadership as well. Not only do we as scientists need to be do a better job communicating with policymakers, we need policymakers to articulate real research problems that they need answers to help drive their decision making in thoughtful ways. But you can take on whatever you'd like to take on over the last few minutes.
Yeah, thank you very much. To link it with what has been said, just on research, on capacity development, I think we need, currently in Africa, for example, I don't think we need critical mass or people very well skilled with capacity in all areas which are required. And that is one of the bottlenecks that we have. And because of that, we have also a very poor link between the little research which is happening in Africa, and even with more research happening out of Africa, but on African questions linked to our policymakers. And that is a situation that we need to correct. I would say we, for example, AMCA, who is in charge of that, to create those kind of platforms where really science can be taught, can be passed on to policymakers in the language that they can understand, and then be able to influence them. And by so doing, we need absolutely to create a strong leadership in the area of sanitation through that kind of encounters, but also through, I would say, a very dedicated advocacy to those critical audiences that we have. Members of parliament, permanent secretaries, ministers, like what we are doing with SWA, but also, and very much importantly, with head of state, because we have seen that where the leadership, the top leadership has understood the need to push to those services in WaSH, things went well. And there is sustained financial levels, even if they are not very high, but at least there is something being given to the sector in a sustained way. This is one of the areas where we need to work. The second is we need absolutely to create the right capacity. I come back to this because I think this is where Africa has failed. Unlike, for example, Brazil. In Africa, it is hard to have those companies which would go to bid for the transformation of the sanitation in one city, for example. And we know that as long as we will not have that capacity in Africa, it will be very expensive and it may not be sustained. The other element that I would like to talk about, and which needs a lot of effort, is the data. The data should be reliable, should be comprehensive, complete enough to allow us planning and design. And currently, we have a problem. Is it a problem of leadership? No, I think it is a problem of capacity. And that is why we are working with National Coordination Platform to see how we can strengthen collection of data at country level. And once it is processed, we are also creating that sort of appetite for the countries to use the findings of the use of those data. Currently, there are so many missing links, which make it very difficult to have reliable data from the countries. And I will end by saying that we have capacity in NGOs and CSOs, but we need again to harmonize the way we see the objectives, the way to work together and strengthen that partnership which is needed between different sectors that work in this area. And then we can share success stories and learn from one another so that among ministers, there are lessons to share. If, for example, you take a country, I will not cite, country A, and you have some lessons sharing with the countries that have made tremendous progress in sanitation, there will be a learning session which may really change the way you see things back at home, and then you will be more attentive towards scientists, practitioners, private sector, and other key actors will bring to your table to shape the policies, the strategies, and also the plans which will be budgeted for so that they can be implemented. I think it is a complex task that we have at hand, but we need to do it. Otherwise, we will be talking to ourselves in forums like this, and things will not be shaken and move forward where we have key people to make changes happen. Thank you. And
No. Thank you. Critically important points. And you know how badly I want to work with you on making that kind of stuff happen. That's absolutely essential. And I want to see these conversations happen. I'm going to turn to Jerson, but then we're running short of time. So after Jerson, what I'd like to do is to go around quickly and ask all of you, what are the messages and what are the opportunities over the course of the next year for us to bring some of these messages out? I know some of you are involved in some other broader international processes where our voice needs to be heard. What are them, and should we be paying attention to any of that? But maybe back to Jerson first, and then we'll do a quick round robin of everybody else to see what else we can do. I'll go back to Katarina first in the round robin.
Well, thank you, Aaron. I want to return to an issue that Barbara raised, the need to people with field experience to be in university and vice versa. I teach in the Graduate School of Engineering in Rio de Janeiro, and most of my students, engineers, they have been trained, as Barbara said, to solve problems, but they are very bad on enunciating, the ability to enunciate the problems. So I think that the role of the university, at least in the graduate level, is to teach how to enunciate. And very quick example, a problem that I give to them. Yeah, problem that I give to them. How do you solve the problem of water supply to a slum? No, it's not only the matter of how to install the pipes. It's how do you face the fact that there is a vendor, that people are paying more to the vendor than they would pay to the utility, and the vendor has he has an interest to avoid utility to provide proper service in that particular area because he gets profits from that. So it's much more than an engineering problem, but engineers that are, say, leading the process, they should be able to understand all the facets of these problems. That's it.
I think Barbara's nodding vociferously, and we couldn't agree more. We need to build those skill sets in our engineers, no question about it. We only have a few minutes. I know we have to wrap up, and Katarina, you've been generous because I know you've got to run. Maybe we'll start with you. As we look forward, what messages, what places, what should we be thinking about for the next year?
I think that from where I work at Sanitation and Water for All, I think we are continuing and we will reinforce the work that we are doing at national level, meaning being conveners of all the stakeholders that Canisius was referring to, bringing them together around the table, the research and learning and the civil society and the government leadership, but to challenge the government, to inform the government. I think that we need to do much more in terms of empowering different stakeholders at the national level to make sure that they know how to claim their rights, they know how to hold those with legal obligations to account. So I think that we need to really reinforce multi-stakeholder engagement at the national level. But then we need to do the top level work like we are doing next week. We have already, while I'm in this meeting, I got more confirmations. We have 33 African ministers confirmed to discuss about how to finance the sector, how to give political priority to the sector in Africa. Wambui will be there, Canisius will be there, Bruce will be there, I don't know, maybe others will be there, but I don't know. And I think we need more of the political discussion and more of the political debates. And then we will have 2 more for other regions. And we need, and yes, there will be the UN meetings. And I think that we need to try to bring it all together. Honestly, what I think we need is a big movement. We need to create a movement for water sanitation and hygiene globally. We need to make water sanitation and hygiene be a topic of discussions in pubs and bars, because it needs to be as sexy as it is to talk about Black Lives Matter or about gender equality, etc. We need to bring it to the day-to-day discussions, and for that we need to tap at the highest political levels. Sorry. Thank you.
Don't be sorry. Thank you, Katarina. That's exactly right. Maybe Jan Willem, go to you for closing thought here.
I'll go with Katarina into that bar and talk about water and sanitation for as long as she likes, as soon as we can again. So much good food for thought, and so much reflection, and so much difficulty, and then figuring out, so what are we going to do the next year? So let me stick to an earlier message and say it, and bring it back to how do we respectfully listen to each other and to our partners, and like, what does that mean for me as a donor in the Gates Foundation? Listen better and listen more to our partners, and find ways to make the interactions less of a one-directional, one-way creation. For working towards, next year, if we're saying we're closing this conference and we're going to think about the next one, I would love to work with you and with others who are interested in this on saying, well, if we start small, how can we do this at the conference better? How do we make sure that presenters from universities in low income countries get the stage and get their names on papers and are heard and start making the contributions that they have been making, but that have been less visible? And how can we make sure that the large and inclusive audience that was at this conference is again able to participate next year? So I'll keep it small and move on.
I had forgotten to mute myself, and so that was Kata giving you an ovation in the background there. Bruce.
I'm always the thing I want to say always changes, and just in response to what Jan Willem was saying, I wonder about pairing. So you take some of these high-level people that are all around me, and you're all very accomplished, and you pair them with someone, just like when you go onto a football pitch or a soccer pitch, and you see the two people coming in together, and they work things out together, and they have that discussion sort of ahead of time, and they have a dialogue, and maybe we could do something like that. Because the other thing, I mean, you were probably leaning a bit, Aaron, toward this whole issue of what are the big international events, and we have the President of the General Assembly, talking about WaSH, and then we have obviously Katarina's finance ministers meeting, which I just think is the thing we all know. And we have a 2023 review from the UN. All these things are happening, but in sort of within all these things, we need to be made uncomfortable, because I think we're actually on the right path. I think we are on the right path, but I think we always need to be made uncomfortable. And it gets back to that inequality discussion where I think, you were uncomfortable talking, I was uncomfortable listening, and we all benefited from it in the end. And I think somehow we need to challenge ourselves in these discourses so that we're never just sort of like, I'm saying something clever, listen to how wise I am. Anyway, so I'm going to end with that and just thank you and everyone for the, the ability to have more voices in the discussion.
Thank you, Bruce. I've been warned that we may be cut off in a couple of minutes because I've gone too long, but maybe quickly turn to Wambui, Canisius, and Sneha, and then Barbara for a couple of small final words, and then I can wrap up. Wambui.
Okay, thanks. Thanks. Very quickly, I think that go back to the leadership issue, the state and its actors, local governments, utilities. I think we need to strengthen that and change how we work together. I mean, from the bank, for example, we certainly would like to signal a different way of working, that reforms matter, that systemic change, based on everything we've seen, systemic change is what we need. Otherwise, we will be, doing everything, and after a few years, we lose all that ground, like is the case currently. So I think as an external partner and others, we can signal a different way of working, a different way of measuring, and that things are going to take time. And then I just say that the question of discomfort, it was very uncomfortable at the beginning of the year to not have my KPIs, the 1-point-something billion. But then I got used to the idea because we are looking at a result, we are working together, and we've learned something new that we really need to take to the next step. Finally, as a bank, the value we can add is implementation. We are on the ground, and we would like to invite research institutions to really help us influence how we work, the kind of questions we ask, how we learn, and how we implement what we learn. So again, thank you very much for organizing this. It's a fascinating conversation.
No, thank you. And we are here for you. So please, let's have that conversation. Canisius, really short.
Very short. Thank you very much. When I was at the East African community, we used to have the head of state retreats on infrastructure and investment. Those are head of state. They will come, they will listen, they will discuss, and they will come with some commitment. And those were somehow respected. I'm thinking, could we think the same thing and have like a leadership retreat on WaSH, and then select those guys and work together, scientists and as technocrats in different areas, to make it work so that they don't hide behind, I don't know. They know from that what they need to do, they make commitment, and we will make a follow-up on that. I think that will then also adapt the concept Bruce has said on pairing, because naturally they will be paired. They will be together, they will speak, and they will learn from one another. And if we do that, probably it is something which can change a bit the way we work and change the way we decide.
I like the idea. I like the idea, Canisius. Sneha, and then we'll turn to Barbara.
Thanks,
Very
Aaron.
quickly.
I think,
sorry.
yeah.
We are
I
going
think
to get
we're
cut
going
off.
to take all these messages that we have learned to the finance ministers meeting, which happens in Asia, and the SACOSAN, the regional sanitation conference, and what all, everything. But what I would like to see in this conference that we should be building upon to produce examples of, are there any cases that where there is a tracking of progress of budgets with transparent and participative monitoring systems, so that we can see really those last mile people have reached, or those LNOB groups are addressed. And I also would like to see whether the commitments made in these bigger platforms, be it is financial ministers meeting, be it is sector ministers meeting, be it is SACOSANs, whether they are committed or accountable to those commitments that they have made. I think we should be able to produce that and make this conference much more uncomfortable. Maybe it is, but then even. And I would also like to see whether this particular collaborative approaches that have come together for COVID will sustain for longer. Are there any lessons that we have learned now are sustainable over a period of time? This is what I would like to see. Aaron, thanks a lot for all this wonderful opportunity.
No, great suggestions. Barbara, very quickly. Sorry to put you in the spot.
Bit of personal advice for everybody coming from this. Every time somebody asks you to do something, please, I think what I'm hearing is we all have to be very empathetic. Put yourself in the shoes of the person who's asking. So if Bruce says, please come to a WHO meeting and tell us about your research on X, don't go and give the lecture you would give to your research group back home. Put yourself in Bruce's shoes and work out what Bruce needs you to do and communicate that message. We've all got to get better at seeing things from the other person's side, and that way these pairings and these partnerships can work really well. And if that's one thing we practice at this conference, I think that's great. So well done for creating the opportunity.
And let's take that one step further. One of the things I try to do is to go to every poster that's presented at a meeting like this. If nothing else, to take the opportunity to engage the young scientists and the young researchers, and to begin to do that pairing, and to show them that we're here to be talked to, right? We're not idols that they shouldn't be too terrified to send an email to or something like that. No, we're actually here for them to have those conversations, to open those doors. And that gets me back to the conference. Thank you, everybody on the panel. They always tell me that, how are you gonna fill an hour and a half? And I can never get everything in to an hour and a half. And that's really just justice to all of you and the greatness of the people around me in these panels. So I appreciate it. Thank you very much. A couple of quick things as we close up. I said it at the outset, but it's really the contributions from all of you who attend this conference that make it so great. We had, I think it count a few minutes ago, 3,439 people registered on this site to access material from over 100, over six, what? 6,000. Sorry, over 6,000 people have registered for this event and are accessing the recorded content and the material from well over 140 countries. That's a remarkable accomplishment. And I hear you, Sneha, we need to have conversations about how we really deliver for the people that we are trying to reach. Start preparing for next year. Do talk to us, put your comments in the chat, send us comments, fill out the reply form. We'll be sending out a call for abstracts in January. So be thinking about the key themes that we need to talk about next year. And then hopefully you'll all be able to join us in person for the 2021 Water and Health Conference, October 4th through 8th, 2021. We very much look forward to seeing all of you then. Thank you so much for everyone, some who listened in live, but for the many others who will be listening to this recorded. To our panelists, thank you so much. And again, thank you everyone for a great conference. Take care.
Thank you.
Thanks
Thank you
so
so much
much.
for the opportunity. Thank you.
Thank you. Thanks everyone, and take care. And
Really
thanks,
great.
Andy.
Well done.
Thank
Thank you, everyone.
Thanks,
Take care.
everyone.
Thank you.
Thank you.
Thank you.
Bye.
Thank you.